virus that many people carry from childhood without knowing it. It's the same virus that causes chickenpox, called varicella zoster virus. When a person has chickenpox, they get better, the sores disappear, the fever subsides, and life goes on. But the virus doesn't disappear completely. It remains hidden in the nervous system, as if sleeping inside the nerve roots near the spine. For years, or even decades, it can remain dormant, until, at some point, when immunity weakens, it awakens. This can happen with aging, intense stress, illness, treatments that reduce immunity, or simply with the natural decline of the body's defenses after age 50. And when it awakens, it doesn't return as chickenpox. It travels down a nerve and appears on the skin as painful blisters, usually in a band on one side of the body. It can appear on the torso, back, chest, face, neck, or other areas. And here we need to dispel a common misconception. Shingles don't appear because you caught a cold wind, slept with the window open, or because shingles went all the way around your body. That's a myth. What really happens is the reactivation of an old virus following the path of a nerve. The danger isn't the legend. The danger is the nerve pain, the eye pain, the weakened immune system, and the complications that can follow. Often, the first warning sign isn't even blisters. Before the skin changes, a person may feel burning, tingling, pricking, deep itching, or strange pain in a very localized area. If it's on the left side of the chest, many people think of the heart. If it's on the back, they think of the spine. If it's on the face, they think of sinusitis or allergies. And when blisters appear, some have already lost precious days. Therefore, the rule is simple. Pain in a band, on one side only, with burning, tingling, or blisters, especially in adults over 50, deserves prompt medical evaluation. There's an important window of opportunity in treatment. Antivirals such as acyclovir, valacyclovir, or famciclovir work best when started early, especially within the first 72 hours. This doesn't mean there's nothing more to do after that, but it does mean that waiting to see if it goes away can be costly. The most common mistake is treating it as an allergy, applying any ointment, covering it with clothing, and only seeking help when the blisters are already drying up. The problem is that while the skin may seem to be improving, the nerve may have already suffered greater damage. And this is where the most feared complication comes in: postherpetic neuralgia. This difficult name means something simple and cruel. The pain continues even after the skin is healed. The sheets hurt, the shirt hurts, the wind hurts. A hug can be uncomfortable. The person starts sleeping poorly, becomes irritable, tired, avoids going out, avoids hot showers, avoids tight clothing, even avoids physical contact. And since there is no visible wound, many people around minimize it. But it's not psychological. It's real neuropathic pain. It's the nerve sending wrong signals to the brain, like an alarm going off, that no one can turn off. Now, if shingles appears near the eye, the situation becomes more serious. Blisters on the forehead, around the eyes, or on the tip of the nose are a sign of urgency. The virus can affect delicate eye structures and cause inflammation, scarring, vision changes, and, in severe cases, vision loss. Don't wait until the weekend is over. Don't try eye drops on your own. Seek medical attention the same day. Another common question: is shingles contagious? The correct answer is you don't transmit shingles directly to another person. However, the fluid from the blisters can transmit the varicella zoster virus to someone who has never had chickenpox or has never been vaccinated. This person may develop chickenpox, not shingles. Therefore, while the blisters are open, it is important to cover the lesions and wash your hands. Avoid close contact with babies, pregnant women, immunocompromised individuals, and people who have never had chickenpox or received adequate vaccination. But there's a part of this story that many people still don't associate with shingles: the heart, blood vessels, and brain. Studies have observed that people who have had shingles may have a higher risk of cardiovascular events, such as stroke and heart attack, especially in the period close to the episode and also in long-term analyses. The likely explanation involves inflammation, stress on the body, changes in blood vessels, and greater vulnerability in those who already had risk factors. This doesn't mean that everyone who has had shingles will have a stroke or heart attack. It means that shingles shouldn't be treated as just a skin disease. And now comes the preventative part. In countries like the United States, the CDC recommends 2 doses of the recombinant shingles vaccine, known as Shingrix, for adults starting at age 50, even those who have had shingles before. For adults with compromised immunity, the recommendation may start at age 19. In the United Kingdom, the NHS has its own eligibility criteria based on age and immunosuppression. In other countries, such as Canada and Australia, the rules may vary depending on the healthcare system, age, risk, and availability. Therefore, the right question is not, "I saw a video, should I get vaccinated today?" The right question is, "Doctor, given my age, my history, and my immunity, am I already a candidate for the shingles vaccine?" The vaccine doesn't promise youth, miraculous cures, or absolute protection. It exists to significantly reduce the risk of shingles and especially the risk of that prolonged pain called postherpetic neuralgia. In recent years, an interesting scientific discussion has emerged. Some studies have observed an association between vaccination and a lower risk of dementia. A study conducted in Wales, published in 2025, found about 1/5 fewer new diagnoses of dementia among those who had the older vaccine. But note, this still doesn't make the vaccine a dementia vaccine. The official recommendation remains to prevent shingles and its complications. The possible protection of the brain is a promising hypothesis, still under investigation. So let's put it all together. Shingles starts with an ancient virus. It awakens when the body's defenses weaken. It follows the nerve, causes blisters, can cause intense pain, can lead to chronic pain, can threaten vision when it gets close to the eye, and can be linked to higher risks in vulnerable people. But there's also prevention. There is a vaccine. There is early treatment. There is a simple conversation that can change the course of your health in the coming years. Therefore, if you are over 50, if you have someone in your family that age, if you live in the United States, United Kingdom, Canada, Australia, or any country where the shingles vaccine is part of the recommendations, take this question to your next appointment. Should I get the shingles vaccine now? And if you have a burning pain, blisters on one side of your body, or lesions near your eye, don't wait. Seek medical attention. The sooner you act, the greater the chance of avoiding prolonged suffering. And tell me in the comments, did you already know about shingles? Have you ever had shingles? Or did you only just discover that this pain can be prevented? Share this video with someone over 50, because maybe that person has never heard of this vaccine. And this information can protect not only their skin, but also their sleep, vision, nerves, and quality of life. My golden tip is not to wait for shingles to appear before thinking about prevention. If you are over 50, or if you have any condition that weakens your immunity, write down this question and take it to your next appointment. Doctor, should I get the shingles vaccine now? This simple conversation can help prevent pain that often doesn't show up on exams, doesn't leave marks on the skin, but can steal sleep, peace, and quality of life for months. And if you notice painful blisters on one side of your body, intense burning, strange tingling, or any lesion near your eyes, if this video helped you, please share it with someone over 50. Your parents, grandparents, friends, or family members, because perhaps that person has never heard about this vaccine and the real risks of shingles. And remember, this video is for educational purposes only and does not replace medical consultation, diagnosis, or individualized treatment. Each person has a different health history, so any decision about vaccines, medications, or treatment should be made in conjunction with a trusted healthcare professional. Thank you very much for watching. Take good care of your health, because prevention is always better than treating a complication later. Until next time.